Hi, my name is Annie Marsh. I am a brand new family nurse practitioner looking for my first position. I know that as a hiring manager or recruiter, you're probably having to wade through many applications. So I decided to help you out a little by answering some common first interview type questions. And that way you can try me on, see if you want me to come in for an in-person interview. So first question usually asked in an interview is, what can you tell me about yourself? So you can see I've got a picture of the Eiffel Tower in the back. I love languages, minored in French, and I'm trying to teach myself some Spanish since French isn't quite as useful in this profession, at least not in Utah. I also sing in Italian. I do everything from opera to musical theater to pop and jazz. I'm not amazing or anything, but I really enjoy dabbling in it. So why did I become a nurse practitioner? Well, I pursued my nurse practitioner degree because I love growing and progressing professionally. I was really excited about the ability to help patients in a new way and puzzle out diagnoses and figure out the best course of action, kind of that problem solving of putting all the data points together. Can you list some strengths? So some of my strengths, I actually have included this on my LinkedIn. It's a letter from Dr. Scott Rallison. He was my OBGYN preceptor. And he listed some of my strengths, and I thought hearing from him would be great. He said, I found her to be very hardworking, easy to get along with. She also got along well with the office staff and patients. I also found her time with me to be a benefit to me and my patients. She had good skills in taking history and doing an exam. She was able to synthesize this into a differential diagnosis and plan. So I agree that I've got some strengths there, but I acknowledge the need to continue to work on those skills. What I would describe as one of my biggest strengths is making templates, kind of a process through the templates. Healthcare, coding, billing, our current understanding of diseases, it's always changing. In my past roles, I've addressed these challenges by implementing and updating templates. I plan to do this in my FNP role as well so that I can always provide the most up-to-date and evidence-based care. That'll also help me be more time efficient if I'm not having to go and search for where everything is. Third strength, don't know if I should list three, but since I've got you captive and you can fast forward if you want to, we'll go with another strength. I'm fairly savvy when it comes to technology and education. On LinkedIn, I have included links to some recorded PowerPoint/webcam presentations on topics like ovarian cancer. I've also included my 100-page MSN portfolio, which I'm sure you're anxious to read. Of course, I know no one really is probably going to read it, but it's there if you want to sift through it. Next question is about what weaknesses do I have? Sometimes I ask too many questions. When I was little, I used this as a technique to get my dad to keep tucking me in longer at night. He always teases how when I was around 4 years old, I asked him how glass was made because I knew he'd get interested in that and stick around and I'd get to stay up later. So the way this can be a problem, sometimes people aren't interested in it at the time or whatever, but I find this inquisitiveness results in an increased understanding, retention of knowledge, and then I've got random facts that can be a fun way to connect with patients and break the ice. Next question is, why should you consider hiring me? I am a super loyal, hardworking employee. I take time to invest in my coworkers, learn specifics of the job. I make sure to create great relationships with both coworkers and patients. I am able to balance patient satisfaction scores with quality outcomes and the financial bottom line. I'm also a brand new family nurse practitioner, so you can mold me however you want. So I guess I don't come with any bad habits yet. Where do I see myself in 5 years from now? So 5 years is a long way off. I see myself investing, watching my opportunities, evolving and growing. That means if I'm working with the same team, doing the same thing, that's great. But I could also see myself pursuing other opportunities, seeing other specialties, other primary care offices, and I'm okay with that wide open uncertainty. The flexibility of the family nurse practitioner degree is why I chose this path ultimately. In 5 years, I guess I plan to see myself as a competent family nurse practitioner with great coworkers and constantly growing. Next question, how do I interact with families and patients? So I already mentioned a little bit about breaking the ice, trying to connect, but ultimately the answer that I want to say is compassionately. I try to create a warm environment that will encourage the patient to give me all the pertinent information and allow them to be receptive to my treatment plan and education. What plans do I have to improve myself over the next year? So this question is typically a retrospective question. What have I done? Since I just graduated with my master's degree, I think that's pretty evident. So I want to talk about what I plan to do. I have compiled a list of about 20 different courses I would like to attend. I know that's not possible for me to do all of those, so I plan to narrow that down based on wherever I accept a job. Some of the courses that I thought were really interesting included one on joint injections, which would be very helpful if I got a position in physical medicine, or even primary care could use that quite a bit. There's a lot of pain procedures, general courses to make my suturing skills better, all of those things. But what I think is most important for you to know is that if I do choose a specialty over primary care, then I want to pursue the professional certification for that area. If it's in cardiology or nephrology or rheumatology, I want to make sure I'm an expert so that I can answer my patients' questions, detect abnormalities, and do everything efficiently and quickly, which comes with increased knowledge. So this next question is kind of hard to answer in a general form, and it's, what is your salary expectation? So I look at the total compensation, number of hours worked, on-call or weekend differentials, and location of the job. If it's in Utah versus New York, the living expenses, all of that. So a very rough number I'd put out there would be about $99,000. What motivates me? Simplest answer is connection. I am so motivated by connecting with coworkers and patients. That's how we feel rewarded, and it brings happiness, and it helps patients get better outcomes. Okay. So what makes a good team player? In my opinion, it's simple. It's someone who's enjoyable to work with. Some ways to be enjoyable to work with is the ability to listen to your coworkers' viewpoints, ask questions so that you make sure you understand their side fully. I think a good team player needs to be able to express their own ideas for the solution, as well as listen to their teammates' solution. And sometimes that means accepting the other person's solution. Openness to criticism and willingness to make changes are also very important for team players. I probably should have added a question here about how I respond to criticism. In the healthcare field, there's always going to be opportunities to grow, and I anticipate having coworkers providing constructive criticism, and sometimes it might not be presented so constructively if someone's frustrated or stressed or whatever. I do a really good job of not responding angrily or rashly in the moment. I process it, I think about it, and come up with ideas to help make the person feel heard and address the issue. And I come back to that person and let them know. Sometimes it's only appropriate to say, sure, I'll work on that, or if you have an idea right away that's good, you can bring that up. But usually I'm a little more pensive. I like to take a step back and make sure that I can put my best foot forward. Okay, so at the end of the first interview, oftentimes manager will ask me what questions I have for them. Obviously, I can't hear your answers, but I do want to ask you some questions. I'd like to know what you love most about the company that you work for the department that I'm interviewing for. I want to know if there are any essential traits for this position that I haven't demonstrated. I'm really curious to know more about the personalities of the physicians and nurse practitioners or physician assistants or medical assistants, anyone who works in the practice. And I'm really receptive to any advice you have for how I could better work well with this team. So I hope to hear from you. Once again, my name is Annie Marsh, looking for my first family nurse practitioner position, and I hope that'll be with you.